Peace be upon you and God's mercy. In today's discussion, we will talk about vitamin D and cover all the things an educated person should know about it, whether they are a doctor or not, and whether they have any connection to the medical field or not. Look, whatever food we take into our bodies has different components. One of them is carbohydrates, such as starchy foods like bread, rice, and all things that can be made into flour, as well as sugar and sweet foods. These are starchy foods that we call carbohydrates. The second component of food is protein, which is found in meat, eggs, milk, and legumes. This is the second part of our diet. The third component is fats, which we obtain from plants as well, especially seeds that are crushed to extract oils. In addition, there are animal fats that enter our bodies in the form of fat. These three types of foods provide us with energy or strength. Besides these, there are three more things in our diet that do not provide energy themselves, but without them, the three food groups I just mentioned cannot be properly utilized. One is water. The second important thing is minerals. By minerals, I mean copper, iron, magnesium, zinc, manganese, and other trace elements. These small quantities of metals and minerals are also essential for our body's growth and development. The final thing is vitamins. Vitamins are chemical compounds. If they are absent from our bodies, the entire system through which we utilize food for growth, disease resistance, and cell development would come to a halt. To understand vitamins, I would like to mention that they are of two types. One type dissolves in water and is called water-soluble vitamins. These include vitamin C and the vitamin B complex. It is called a complex because vitamin B is not just one vitamin. There are B1, B2, B6, B12, and a whole series known as the vitamin B complex. The second type is fat-soluble vitamins. They do not dissolve in water, they dissolve in fat. These are vitamins A, D, E, and K. Among these, one very important vitamin, although all vitamins are important, is vitamin D, which is what we want to discuss today. The reason this discussion is important is that vitamin D deficiency is extremely common throughout the world in general and in Pakistan in particular. If you started testing the entire population of the country for vitamin D, you would be surprised to find a very large number of people who are deficient. This deficiency leads to many health-related problems. I am confident that after listening to this discussion, we will understand those issues and develop a positive perspective regarding vitamin D. Now, I would like to explain the role of vitamin D in our body. We obtain vitamin D through food, but the body also has a remarkable chemical mechanism. Under our skin, there is a fat molecule called 7-dehydrocholesterol. If you do not remember the name, that is fine. Just know that it exists beneath the skin. When our skin is exposed to sunlight, the ultraviolet rays from the sun interact with this molecule and convert it into vitamin D. However, the vitamin D produced under the skin is still in a raw form. To become active, it first travels to the liver, where it is converted into 25-hydroxy-vitamin D. Again, if the name sounds difficult, just remember that vitamin D goes to the liver and undergoes further processing. From there, it travels to the kidneys, where it is converted into its active form. This is the form of vitamin D that the body can actually use. Once active, it circulates throughout the bloodstream. As you know, the entire body is made up of cells, each with an outer membrane, a nucleus, and a membrane surrounding the nucleus. Vitamin D attaches to receptors associated with these cells and begins influencing cell regulation and various cellular processes. The body parts whose growth depends critically on vitamin D include, most importantly, bones and muscles. If vitamin D is deficient, bones become brittle, joints weaken, soft tissues become weaker, and many bone-related diseases begin to appear. Similarly, vitamin D is essential for the health and growth of our skin and related structures such as nails and hair. Our eyes are another area affected. Proper development and functioning of the cells responsible for vision are also greatly influenced by the availability of vitamin D. Now, I would like to draw your attention to vitamin D's importance at the cellular level. The system that protects our body from diseases is called immunity. This immunity is of two types: innate immunity and adaptive immunity. Let me explain. Suppose we are sitting in an office and have guards stationed outside. If anyone attacks, these guards respond without first identifying the specific type of attacker. This is like innate immunity. Whenever germs enter the body, the first line of defense is what we call innate immunity. Adaptive immunity is different. Imagine a specific attacker arrives carrying a specific type of weapon. We have a specially trained guard who knows how to deal with that particular weapon. Similarly, if the COVID virus enters the body, our immune system develops a specific response against COVID. If it is tuberculosis, a response specific to tuberculosis develops. This is adaptive immunity. Vitamin D significantly improves the efficiency of innate immunity, strengthening the body's first line of defense against any invader. In adaptive immunity, two important types of cells are involved: T cells and B cells. The development and proper functioning of both are strongly supported by vitamin D. In short, if there is no vitamin D deficiency in the body, our immune system remains alert, efficient, and better prepared to handle diseases. Another important point is that when severe infections occur, the body uses various mechanisms to fight them. Imagine that an attacker enters our office. To stop them, we might do things that are not normally done. We may grab a flower vase, overturn a table, drag a cupboard into the way, or throw books at the attacker. The goal is to stop the attacker. But in doing so, we may also damage our own surroundings. Similarly, during severe infections, the body produces chemical substances such as interleukins, cytokines, and tumor necrosis factor. These substances help fight the infection, but if produced excessively, they can cause considerable damage to the body's own tissues. This excessive immune reaction is known as a cytokine storm. The COVID pandemic provided many opportunities to study this phenomenon, although it was already known from research on other infections. In many cases, the damage caused by the cytokine storm can be greater than the damage caused by the infection itself. When a cytokine storm occurs, the lungs are particularly affected, but the kidneys and heart may also suffer damage. Sometimes patients die not directly because of the infection, but because of the damage inflicted on these organs. Many medicines have been developed to reduce cytokine storms. Vitamin D is considered an important factor in this context. If there is no vitamin D deficiency, the severity of cytokine storms tends to be lower. Some studies have even investigated whether vitamin D supplementation can reduce cytokine storms, although the scientific evidence is not yet entirely conclusive. However, studies clearly show that people without vitamin D deficiency are generally better able to cope with cytokine storms. Regarding COVID-19 and the coronavirus pandemic, many studies conducted by the WHO and universities around the world suggested that vitamin D deficiency is an independent factor associated with increased susceptibility to COVID symptoms and poorer outcomes. In people who develop COVID, deficiency may contribute to reduced immune function, increasing illness severity and mortality. For this reason, vitamin D became part of first-line treatment considerations in many COVID-related approaches, and not only for COVID, but also for many illnesses caused by viruses and other infectious organisms. This was a broad overview of the importance of vitamin D. It has also been observed that vitamin D deficiency may increase the risk of heart disease and stroke. As research continues, we are likely to learn even more about vitamin D. Like minerals and other vitamins, it is a very important component of nutrition. If deficiency is not identified and corrected in time, significant harm to health can result. Another major factor highlighting the importance of vitamin D is its role in healthy aging. As time passes, Everything ages. If you buy a house, over time, its walls may weaken, its doors may begin to creak, and its electrical systems may become less reliable. Gradual changes occur simply because of the passage of time. The same happens in our bodies. Sometimes when I look in the mirror, I notice wrinkles that were not there before, or gray hairs that did not previously exist. As people age, their posture changes. Similarly, the cells inside our bodies also undergo age-related changes. Vitamin D deficiency can accelerate this aging process. To summarize, everyone should know whether they have vitamin D deficiency or not. You can consult your doctor. Nowadays, simple blood tests are available that can determine vitamin D levels. In Pakistan, many institutions, companies, and universities are conducting research and developing guidelines on how vitamin D deficiency should be treated. My advice is to consult your doctor. The key point to remember is that vitamin D deficiency is extremely common in our region. There is a significant possibility that you or I may be deficient without even knowing it. If a deficiency is detected, simple dietary changes and appropriate supplements prescribed by a doctor can help us benefit from this wonderful blessing of nature called vitamin D. Thank you. The key message is simple. Vitamin D deficiency is extremely common. Get your levels checked, consult your doctor, and if needed, correct it through diet or supplements, because this small step can protect your long-term health. Thank you.